Tonight, we're joined by Dr. Kristen Moffitt in the Division of Infectious Diseases at Boston Children's Hospital. Good to see you once again. I want to talk about the American Academy of Pediatrics today, saying they're really concerned that fewer kids are seeing their pediatricians, and with that, that kids may not be getting their vaccinations on schedule. What's the harm with that?
Yeah, there could certainly be significant harm from that, particularly for children who are very young. So between the first year to year and a half of life, infants and young children are getting really critically important vaccines that need to stay on schedule to prevent infections like whooping cough and bacterial meningitis. So if families are avoiding these important scheduled visits and thereby avoiding these vaccines, there's the potential for increased rise in cases of otherwise vaccine preventable infections in these children. So
Right.
It would be really important for parents to have conversations with pediatricians' offices about everything that's being done to still be able to safely deliver these vaccines.
And we know there are really innovative solutions happening.
Very
I
much
want to
so.
ask you about some doctors reporting a really unique COVID-19 symptom in adults and kids involving their toes. Can you tell us what this is about?
Yeah, it's really interesting. I think the Google searches for COVID toes, I'm sure, have seen big spikes, but there have been some reports of increased findings of these sort of purplish and swollen lesions on toes. And this seems to be more common in younger adults and children.
Right.
Whether or not this is really associated, though, with COVID-19 infection is still a little bit unclear. In some cases, children with these findings have gone on to test negative for COVID. In some cases, though, they have tested positive. So I think there's still a bit more data remaining to really determine whether there's an association, but certainly worth discussing with your doctor if you're having any of those symptoms.
Okay. All right. Good to know. We know that Children's does have some patients that are hospitalized with COVID, including some in the ICU. And we also know that hospitals aren't allowing visitors or family, especially in intensive care. For adults, in many cases, is it different if it's a child in the ICU with the virus?
Yeah, it is different for children. We certainly recognize how unbelievably stressful it would be for anybody to be hospitalized, and much less in the ICU with this infection. And you can imagine how unbelievably scary that would be for a child in particular. So our hospital policy is that 2 adult caregivers can be in hospital with their child when they are admitted here. And that's true for our patients with this infection as well, so that our patients are not alone when they're here.
Yeah, so important. All right, Dr.
Yeah.
Moffitt, thank you so much for your time.
Sure.
We really do appreciate it.